Boom, selector. Check it. Today we is chatting about medical ethics. What is the illness that they give out ganja for?
I believe they've used it for glaucoma.
Where could I catch a disease like that from?
I don't know you catch it. I think it's something that can develop.
Does they give you like Kingston super skunk, or does they just give you normal Maui Maui?
That I don't know.
Is normal medicine best at curing people, or should you look to alternatives? Now, you is a homophobic doctor. What's that like?
Homeopathic.
All right. All right, yo.
Yeah.
No, seriously, keep your own prejudices at home, because, you know, there might be gaylords out there who's watching this now. I don't want you to insult them. So
No, you used the word homophobic.
You should take that back, that word that you said.
I didn't use the word you did. I used the word homeopathic, which is a system for deciding when people are sick, what medicinal substance will most help that individual.
I think it's wrong to say that them people is sick. They've got a different way of living than us.
You have misunderstood, sir.
I don't want to be the guy who's in charge of this whole thing saying that kind of language is okay. Sorry. So, what is cloning?
Cloning is basically where they take a cell and they make it grow into a living creature.
Does you think cloning is right?
Doing something this unusual is very, very dangerous. First of all, we already know that their experience with this has shown many, many failures.
All right. Well, what about if you could clone Foxy Brown? I bet you wouldn't say no to that.
Well, since I do not know who that individual is, I can't say absolutely no.
Foxy Brown, you know, she ain't called Foxy for nothing. She's fly like Sirius Babylon's.
I see.
Yo, would you be into that if you could clone Foxy Brown?
No.
I was getting you, don't like brown sugar, whatever. What about if it was Carmen Electra?
No, because basically I'm opposed to the issue of producing life in this circumstance.
All right, I was getting you. I didn't mean to assume anything. So what about if it was George Michael's? Would you be up for cloning him?
No, as I said before, scientifically it is not known what will ever occur in such a circumstance.
There was two boys in my school called Alan Lambert and Phil Lambert, and they was exactly the same, like same hair, same eye color, same height. They even was born on the same day. Does you think that they was clones?
No, they weren't cloned. They were what is called identical twins.
How does you know that they was twins?
Well, the nature of the way the mother had to...
Does you know them?
Yes. Yeah.
You know
The
Phil
doctors,
or Alan?
I don't know those two
All
gentlemen.
right, because I think Phil moved to America, that's why I thought maybe you met him or something.
Oh, no.
Let's talk about doctors. Does they have the right to end old people's lives?
That's euthanasia.
Why is it the responsibility of the euthanasia for killing someone else? Surely it's between that patient and the doctor.
Euthanasia is the term that's used when you are killing. It's a nice word for killing.
Well, whatever. You were saying that it's mainly Asian youths that is...
No.
Does you think that they're responsible for this? You don't also agree with him?
Who's responsible for it?
No.
The euthanasia.
I think we're getting confused here. Euthanasia comes from the Greek word for death.
Let me understand what you were saying. You were saying that it got nothing to do with young people in Asia. You were saying that occasionally there's some doctors here who may be from Asia who do this.
That's correct, but they could also be from the United States.
But they're mainly from Asia.
No.
Even
No,
though
no.
the ones that are there behave themselves
No.
very well.
No, the Asians,
they have
we
nothing
have
to do with
absolutely
Asia.
no evidence that the Asians do it more than we do.
So let's talk about plastic surgery. I heard about this thing, and it's probably rubbish, that some girls actually gets their Babylons reduced. Is that true?
Yes, it's true.
For real?
What? Yes.
Oh, yes.
Ain't that selfish though? Because like, it's one woman getting backache, but you was taking away thousands of men getting pleasure, isn't it?
I think you're misunderstanding once again. I'm talking about grossly enlarged, where they are not attractive.
Well, I was talking about nice ones.
Oh, I see. Well, it's a matter of taste.
Respect. So, chat about that after.